Alrighty, so today we're going to be doing the abdominal exam. So I've walked in, I've introduced myself to the patient, I've washed my hands, identified the patient using two identifiers. So I'm going to first start by inspecting the skin on the abdomen, just for color, texture, temperature, edema, any skin turgor, moisture, edema, moles, anything like that. Everything looks fine. Then I'm going to assess the contour, and I see that her stomach is flat, no distension, no protuberance, nothing like that. So all normal findings. So now we're going to move into auscultation of the major blood vessels in this area. We're going to use the bell of the stethoscope. We're going to start off with the aorta, just assessing for any hums or bruits. Okay, now we're going to move to the renal arteries. Okay, iliac. And femoral. Okay, perfect. Yeah, so no signs of any bruits or hums. Now we're going to begin the palpation portion of the assessment. And so first I'm going to start with the before we get into palpation, I'm going to listen to all four quadrants. I'm going to start with the right lower quadrant and use the diaphragm of the stethoscope, listening for bowel sounds. Good. Okay, so bowel sounds were active, normoactive, no hyperactivity, and no hypoactivity. So now we're going to move into palpation. So the first thing I'm going to do is move around in a clockwise motion. Start in the lower quadrant, just some light palpation. Just noting for any tenderness or any guarding. Any pain while I did that? No. Okay, now I'm gonna move into a little heavier palpation. Okay, good. Any pain while I did that? No, I didn't notice any guarding either. So the next thing I'm gonna do is palpate for the liver, right in the right upper quadrant here. Okay. Should be about 6 to 12 centimeters. Good. Okay. Now I'm going to palpate for the spleen. Okay, and I don't feel the spleen, which is good. If I do feel the spleen, that means it's 3 times the size that it should be normally, and in which case I would stop immediately to avoid any causing internal bleeding. Okay, I'm going to palpate for the aortic pulse. Good, which I'm able to feel instantly. Okay, now I'm going to move on to palpating the lymph nodes. Okay, iliac lymph nodes. Okay, and the femoral lymph nodes. Okay, so yeah, nothing felt swollen or anything like that. Now I'm just gonna have you take a deep breath in. Good. Any pain right there? No. Okay. So I just assessed for Murphy's sign, and there wasn't any pain when she inhaled or anything like that. So that's good, because if it was a positive test, she would not be able to inhale all the way. She would kind of stop herself right there. Okay. So now I'm going to move on to percussion. Okay. Good. Okay. So yeah, so some dullness over the liver, which is to be expected. Yeah, okay. Also, good, okay. All right, so then I would also palpate for, before the percussion, I would palpate for the Trobe's point as well, just for presence of the spleen, which actually I did already explain. So, so moving forward now just to some of the tests. Okay, can I actually have you scooch up for me? Okay. Good, actually as far as you possibly can, even if you kind of put the pillow. There you go, keep sliding up. Keep sliding up, there you go, because I need your legs. Okay. All right, so the first thing we're gonna do is assess for the psoas test, okay? So I'm gonna have you pick I'm holding on to her calf. Pick your right leg up for me. Okay, pick your right leg up for me. Good, okay, put it down. Any pain while you did that?
No.
No, okay. Then I'm gonna have you, okay, lay flat for me. Okay, bend at the knee. Pick your knee up. Okay, bend, there you go. Any pain?
No.
No? Okay, try to fight my hand right here. Kick your leg up. Good. Okay, any pain in the right lower quadrant?
No.
No, okay. Before I did those two tests, what I would do is assess for pain at McBurney's point, which is in the right lower quadrant. And did you have any pain there when I push my hand in and take it away?
No.
No, okay. And then just for the Rovsing's test, what I would do is press in the left lower quadrant and assess for any rebound tenderness there. Did you feel any pain with that?
No.
No, okay, good. All right, I think that's it.